Did you know that some of the most powerful medicines come straight from nature? From the bark of trees to the leaves of plants, nature has provided us with countless healing substances. But how do scientists and pharmacists organize and study these natural drugs? That's where pharmacognosy comes in. Welcome to Education and Learning Medical. In today's video, we'll explore the classification of drugs in pharmacognosy, a branch of science that deals with medicinal substances obtained from natural sources like plants, animals, and minerals. Let's dive right in. 1. Alphabetical classification. One of the simplest ways to organize drugs is by their names, just like a dictionary. This alphabetical classification is used in pharmacopoeias to make searching for drugs easier. Examples include Atropa belladonna, also known as Belladonna digitalis purpurea, the famous heart medicine, Digitalis mentha piperita, commonly known as peppermint. This method is easy to use but doesn't provide scientific insight into the drug's properties. Morphological classification. Here, drugs are grouped based on which part of the plant or animal is used. Leaves, senna, cassia angustifolia, a natural laxative. Bark, cinchona, Cinchona officinalis, the source of quinine. Roots, licorice, Glycyrrhiza glabra, used in herbal medicine. Some products, like aloe juice and honey, are classified as unorganized drugs since they don't have a distinct structure like leaves or roots. 3. Taxonomical classification. This method classifies drugs based on their biological family, genus, and species. It helps researchers understand plant relationships and detect adulteration. Examples include Datura stramonium, from the Solanaceae family, known for its hallucinogenic properties. Papaver somniferum, from the Papaveraceae family, the source of morphine. While useful for botanists, this method can be complex for pharmacists. 4. Chemical classification. Here, drugs are grouped based on active chemical constituents, the compounds that give them medicinal properties. Alkaloids, morphine, Papaver somniferum, a powerful painkiller. Glycosides, quinine, Cinchona officinalis, used to treat malaria. Terpenoids, menthol, mentha piperita, used in cough syrups and balms. This classification is essential for understanding how drugs work at a molecular level. 5. Pharmacological classification. This method groups drugs based on their therapeutic effects, how they act on the human body. Examples include analgesics, pain relievers, aspirin, anti-inflammatories, atropine, cardiotonics, heart drugs, digoxin. This system is widely used in hospitals and pharmacies. 6. Chemo-taxonomical classification. A combination of chemical and taxonomical classification. This method provides a complete understanding of a drug's origin and chemical composition. Examples include strychnine, Strychnos nux vomica, a toxic alkaloid. Ephedrine, Ephedra sinica, used for asthma and nasal congestion. 7. Sero-taxonomical classification. This method classifies drugs using serological, antibody-based techniques, mainly for drugs derived from animal sources. Examples include heparin, an anticoagulant derived from animal tissues. Insulin, a life-saving hormone extracted from the pancreas of animals. This method is important in biotechnology and medical research. Conclusion. So as you can see, there isn't just one way to classify drugs. Each method serves a different purpose, from organizing them in a pharmacopoeia to understanding their chemical and therapeutic effects. Now, here's a question for you. Which classification method do you think is the most useful? Let us know in the comments below. If you enjoyed this video and want to learn more about medicinal plants, pharmacology, and drug discovery, make sure to like this video, subscribe to Education and Learning Medical, hit the bell icon to never miss an update. Thank you for watching, and see you in the next video.